Hi friend, this is Dr. Ru from Passion Dentistry, and today I have done the root canal treatment of mandibular second molar tooth. The patient complains to me that he's having the pain on the mandibular first molar tooth, which he has recently done the root canal treatment from some other dentist. But after doing the proper examination and taking the radiographs, I found that the tooth which complains the pain is not that root canal treated tooth. It's actually a tooth which is on the back of this tooth. That's the second mandibular molar tooth. So I discussed everything with the patient that the problem is here and the problem is not that RC treated tooth. Although the root canal treatment he had done from some other dentist a couple of months before, but that's not as good as it should be. It's only the half of the roots are filled with the obturating material, and so I told the patient to go for the treatment of this tooth. So we will do this after that case. So when I start the treatment of this tooth, I found the patient's limited mouth opening is there, so it's very hectic to do the root canal of the second molar tooth. But I decided that I will do that case, and that I have done very beautifully. Let's have a look on that case. First of all, let's have a look on the pre-operative radiograph of the patient. You can see that in the mandibular first molar, the distal root is not properly filled. Only the half of the root is filled. It's around 3 to 5 millimeters short of the working length. So I told the patient to go for the treatment of that case. Otherwise, it may lead to failure of the root canal in future. But this time, I will work on the second molar tooth and make my patient free from the complaints. Here you can also see the vertically impacted wisdom tooth, by which you can imagine the position of the second molar and the complexity of the case. So after removal of the decay, I'll locate all the 3 canals, I shape them to taper and obturate them to the full working length. Here you can see on this radiograph. And let's have a look on the distal view radiograph. This is the distal canal, this is the mesiobuccal canal, and this is the mesiolingual canal. Here got the composite restorations. My advice for every patient that who are going for the root canal treatment, that please have a brief discussion with your dentist about your root canal treatment in order to avoid those errors. They might be the errors because of the dentist. Maybe he might be in the hurry, or he might not be the professionally sound to do the root canal treatment. So it's better to have a small discussion with your dentist so that their treatment prognosis is better. I hope you enjoyed this video. If you like the video, please do subscribe my YouTube channel, and see you in the next one. Thank you.